Let's review the tests we can use to evaluate for antenatal fetal surveillance. So we can do the non-stress test. Here what we are measuring is the accelerations of the fetal heart, and this is a reactive test if we have 2 or more accelerations in 20 minutes. But remember that the duration of the test normally is between 40 to 120 minutes, because if we have a non-reactive test, if for some reason we have a non-reactive test, a non-reactive non-stress test, one of the causes of this is that the fetus be sleeping. So we do a vibroacoustic stimulation, and we also want to be sure that the time or the period for which we are evaluating the fetus is awake. So the sleeping cycle is like 40 to 60 minutes, the sleep cycle. So for that we normally do the non-stress test maybe for about 40, 60, 120 minutes to make sure that we are evaluating the fetus, at least in some part when the fetus is awake. We can do vibroacoustic stimulation to stimulate the fetus and the fetus waking up. But if this is not reassuring, other causes for non-reactive non-stress test is that the fetus is a premature fetus being less than 32, or sedative effect for drugs the mother is taking, or CNS abnormalities. For example, an anencephaly fetus. If this is a non-reactive non-stress test, then we will do the biophysical profile or a contraction stress test, which is what we are going to see. So other way to do the antenatal fetal surveillance is with the contraction stress test. Here what we are evaluating is the presence of late decelerations. If we have more or equal than 3 late decelerations in 10 minutes, being late accelerations more than 50% correlated with the contractions. If we have more than 50% of late decelerations corresponding with more or 3 contractions during 10 minutes, this is a positive contraction stress test. We have the amniotic fluid assessment. We can evaluate for single deepest pocket or single vertical pocket is the same, where normal is between 2 to 8 centimeters, or we can use the amniotic fluid index, which normal is from 5 to 24 centimeters. The biophysical profile is a combination of non-stress test, amniotic fluid, and other things. So these measure the tone of the fetus, the breathing of the fetus, movement, and non-stress test, and amniotic fluid. And if this is a score 8 to 10, then that's a good score. 6, we should do delivery if the fetus is mature, so more than 36. If less than 36, we repeat the biophysical profile. And if it's 0 to 4, then prompt delivery. And the other thing we do for evaluation is the ratio, is the umbilical artery Doppler velocimetry. So here we evaluate for the ratio of the velocity of the peak systolic, or the peak velocity of blood flow during systole divided by the peak velocity of the blood flow during diastole. In cases where there is no diastolic blood flow or no flow during diastole, or even a reverse blood flow, that's prompt delivery. So antenatal fetal surveillance, this is normally started at 32 to 34 week gestation, and we normally do this weekly, more or less, but this is if it is a patient with high risk for fetal demise, for example. If it's a patient with a lot of risk for fetal demise, then we can start earlier, between 26 to 28 weeks gestation. What do we use for antenatal fetal surveillance? We use non-stress test, contraction stress test, biophysical profile, amniotic fluid assessment, or umbilical artery Doppler velocimetry, but this, remember that is only for intrauterine growth restriction babies.